Okay, so I'm going to be doing a newborn assessment on this pillow I have. And that's the best I can get. So, um, a very important thing with newborns is just infection. You want to really prevent that as best as possible. So always have clean hands, uh, keep good hand washing technique. Just always have caution and keep that in the back of your mind. Also, safety with the baby, so keep the side rails up if you're going to do the assessment on the warmer. If not, another good spot to do the assessment on is on the mom, so they can get skin to skin contact as well as they can transmit that body heat to the baby. So, yeah, one of the first things you want to do is dry, stimulate, get that blood going. After they're stable, weigh baby. You're going to want to get in pounds and kilograms. Um, and so weigh the baby, measure the height. So the kind of going back a little bit, when you want to weigh the baby, um, put some type of cover in between the scale and the baby, just so that heat transfer isn't lost through the scale, or it's not conducted through the scale. Um, so yeah, that, and then you would want to measure the height. There's a few ways to do this. You can either just measure all the way, or you can measure from like the head, or say this is the head, from the head to the butt, and then grab it from there, from the butt to the foot. Or you can just, like I said before, do it all the way down. So once you get the height of the baby, get the head circumference. So get your tape measure. If I had a tape measure, I would show it. But so wrap the tape measure on the head. Get the circumference of that. Get the circumference of the chest. Get the circumference of the abdomen. Let's see. So once you finish with those, get the height and weight. Then you're gonna move on to your vitals. You're gonna get the heart rate. It should be very quick, a lot quicker than an adult's. Measure, and you're gonna want to measure for a full minute because they are known to be irregular. So you're gonna want to get that heart rate for a full minute. And then after this, just look at the overall respiration status. If it's labored or unlabored, it should not be labored. Labored breathing is a very bad warning sign for a newborn. So you're going to want to get the front and the back respiratory on the newborn. So just kind of listening to all the lobes of the lungs. And then go on to the back of the baby and listen there. And it is common to hear wet sounds, especially on C-section, just because they didn't get that extra kind of pressure and that pressure that the vaginal birth got to kind of expel some of those fluids from the lungs. And then, so yeah, you listen to the lungs, you listen to the abdomen, and babies should have a working bowel system. They should have some motion going on in there that you should be able to hear. And then after those, you kind of just do another visual assessment. Look for any lanugo, which is like hair on the baby. It could be on the shoulders, the back. Any vernix, which is that cheesy kind of paste over the baby. And that is good for the baby, good for the skin, so you do want to leave that on. Look for any rashes, any Mongolian spots, which might be on the back of the baby, any stork bites, which is commonly found on the cheeks, on the face, on the nose, and they're just kind of like little scratches, it looks like. Um, Milia would be on the nose as well, the kind of like white spots. Moro reflex, so that's kind of, there's a few ways to kind of get the reflex out of the baby. You kind of like a little scare them like that, kind of a drop like that. Snap fingers, or sometimes just by looking at them, you can get a Moro reflex that way. Don't even have to do anything. And you're kind of, with that, you're looking for a symmetry. Um, you're looking for alertness, one, making sure that they have the reflex, but symmetry, so they didn't have any like traumatic birthing, like any trauma, any injuries to the clavicle, anything like that. So next we will move on to the pin light. If I had my pin light with me, and you would look at the pupillary reflex and the blink reflex. The pupillary reflex, when you bring the light closer to the pupil, it should constrict to get smaller, and the blink reflex is just kind of blinking in the presence of light. Rooting, that's you kind of touch the baby's cheek with your finger, and they should turn towards the direction that you touched them, that side of the cheek. The palmar reflex, so with it works for the hands and the feet. You kind of put a finger inside of theirs, and they will grasp it with the hands and the feet. That's the palmar reflex. So once you're kind of focusing more on these reflexes, you can also look at the sucking reflex, which is just putting your hand in their mouth and see if they suck. And once it's here, you can feel around in their mouth for the hard and soft palate. The Babinski reflex is just on their foot, kind of do an upside down J. The tonic neck is any way that you turn their head, that's the direction they'll kind of point. So you turn their head this way, and they'll kind of shift the body and point that direction. The trunk incurvation. So you put that baby on the stomach, and the finger goes on one side of their body, and baby should turn that way. So you have the baby like this, and you run the finger down the side, and they should kind of curve and turn that way direction. The prone crawl. That's just putting them prone, like face down on the stomach, and that's what that is. The prone crawl is they're prone, they're kind of face down, laying down, and they will kind of scoot their butt up, like kind of scoot it up towards the air. That's the prone crawl. So now we can look at more assessing, just kind of visual assessments, looking at the head. Any molding of the head is normal. It could correct itself within a matter of days. Cephalohematoma is something to watch. That's when gathering of blood that does not cross a suture line. So that could it could be bad. It could be worse. It could be turn into jaundice later down the road. So that's something to keep an eye on, to pay attention to. But something Similar, a little not as bad is the cap capita. Um, that one does cross the suture line, so that one is similar but a lot better, a lot more safe. So you just want to kind of feel around there, feel around the head area, get a good assessment of that area. Symmetry of the face in general, eyes, cheeks, the facial muscles, make sure they're all symmetrical. Um, and while we're looking at the face, look for any forceps or vacuum marks as well, because those can be spotted. Again, there may be milia. And also while looking at the face, the ears, that's important because the ears form around the same time that a lot of the inner organs, like in the center line, form, such as the heart and the kidneys. So something's wrong with the ears. Maybe there's an abnormality or a deformity. That's something to look into. That's something to notify the physician or primary health care provider. Um, so kind of focusing on the face still. Look at both nostrils. Plug up both at each time at separate times. Make sure that both are working. Um, uh, Back to the ears. So ready recoil is when you fold the ears in. They should recoil back in a full term. In a preemie, they may stay when you fold it in. It may either stay or not recoil as quickly. Um, just looking at the face still, mouth symmetry, cheek symmetry, no cleft mouth. Try to get a look at the tongue, make sure it's free moving, that they can stick it out. Let's see what else. So kind of, and then looking at some screening, a good way to assess hearing. The mom and dad talks and the baby looks at the mom and dad. That's a good sign that their hearing is working. Same as for their eyesight. If someone's right in front of them and they kind of are like tracking them with their eyes, their vision is okay. But yeah, the eyes are important. You want to get a good look at everything that's going on in there. The pupillary reflex with the pin light, like we did earlier. The cornea, the sclera. Make sure the sclera is not too yellow. That could be a sign of jaundice. Pull down the conjunctiva. It should probably be a little red, but just make sure it's all okay in there. The perla is something that a mnemonic that we go by. It stands for pupils equal, round, reactive to light, and accommodated. So that's kind of just a good summary to make sure that the eyes are working. The pupils are equal. They react to light, and they're accommodated to light. Neck freely movable. Make sure that neck can move. No breaks in there. Nothing to worry about. No broken clavicles. So the chest should be unlabored. We said that earlier. So yeah, we listened already. We can listen to the heart. Murmur is okay in the first 24 hours. It takes a little bit of time for everything to close up in there. That's one of the only times a murmur is almost to be expected, and it's okay. So you would check the spine. So when you hold the baby, right should be a C shape. They should curve their spine like that. You can look at the hips, symmetry on the hips. Make sure there's no dislocation of the hips. You can check the genitals for males and females. For males, you want to make sure the testes are descended, the urethra is at the tip of the penis, and the scrotum is on both sides. You can palpate for the scrotum. And on women, you want to look for the clitoris, the vagina, the mons, make sure everything is there. Also, on all babies, just assess the cry. Make sure the cry is not shrill, it's an okay cry, it's not a cry like an in pain cry. Yeah, just a kind of general assessment about the extremities and the trunk, the arms, the hands, the spines, the hips, the legs, the feet. Just everything symmetrical, everything is movable. You want to ask the mom about their bowels, any pooping and peeing, what's it look like, the color, how often. It's pretty normal for it to be like yellow and seedy for the babies who breastfeed. And usually they say it smells better also for breastfeeding. The color of the skin. So there's something called acrocyanosis, and that's bluing of the hands and the feet, and that's perfectly okay right after birth. That's fine. That APGAR scores commonly get scored a 9, and that's still a healthy baby. And even so, jaundice within the first 24 hours is not okay. That's called pathological jaundice. I mean, something was going wrong in utero before the baby was born. Physiological jaundice is normal. That's past the 24 hours within, I think it was like the next 3 days of life about, and that's okay. So just while you're on there looking at the skin, kind of blanch the skin, press on it, make sure you got some color back. Look at creases on the hands and feet. That should also give you an indicator of gestational age. The more wrinkled, the more prominent the creases are. Usually the older the baby is. And kind of going back to the voiding, a good kind of ballpark, a good guideline is it goes 1 void for the first day, 2 voids second day, 3 voids third day, and it goes like that for 9 days. So you can have 9 voids the 9th day. And so that's just a good guideline, good range to follow. So yeah, that's all we had for the newborn assessment.